Each year, heart-related diseases kill more than 850,000 Americans, causing more deaths than all cancers combined. There are many forms of heart disease.
The two major types are ischemic, that is heart failure from injury to the heart caused by blockages in the coronary arteries. And the other type is a dilated cardiomyopathy, which is often cause is unknown, but the heart progressively gets larger and larger over a period of time.
Oftentimes, lifestyle changes can prevent some types of heart disease.
The lifestyle changes we're talking about include a good diet, exercise, and eliminating risk factors such as high blood pressure, controlling diabetes, lowering lipids in your diet, and changing habits such as smoking, which is one of the absolute worst things you can do.
But sometimes, those changes and even medications are not enough.
Once we've passed the point of therapy with medications, we turn towards interventional therapies, including catheter interventions with stents and surgical interventions when the chest is open and the patient actually has an operation either to bypass an artery, replace a valve, or correct some abnormality of the heart muscle itself.
When all these therapies fail and the heart is losing its ability to pump blood, it's time for life-saving measures.
The next step is replacing the heart. And if we take a look at the heart now, your heart's as big as your fist, so this blown-up model shows the various chambers of the heart. And what we're really concerned about is over here is the left ventricle of the heart. That's where most of the pumping is done and most of the work is done.
But patients often have to wait for a matching donor heart.
Once a patient is chosen for heart transplantation, he's put on a waiting list. And I want to emphasize the word waiting because he can wait anywhere from one day to many years.
However, some patients are not considered good candidates for heart transplantation.
When we're evaluating patients for heart transplantation, the good candidates are put on the waiting list for transplant, but there are many who do not meet criteria, and they are considered for device support long term.
While waiting for a donor heart, a patient's condition could become critical to the point where they may only have days or even hours to live.
When the patients are on the list taking a turn for the worst and we've run out of medical therapies, then we're looking at a mechanical pump to replace the heart as the only solution for these patients.
On April 10th, Don Scholen's dying heart was removed and a CardioWest artificial heart was implanted. Don's condition improved, and 33 days later, he was successfully transplanted with a donor heart. Don had 3 hearts in 33 days.
Before I received the heart, I was pretty much a goner. I had brought myself to the hospital, and within 3 days of arriving at the hospital, I was on the artificial heart. This is the artificial heart that I had inside my body that saved my life. I was transplanted 3 days ago. I have a new heart in now, a real transplanted heart, and I feel great. I feel good. I'm up and I'm about and getting off all the tubes, back on solid food. I'm feeling very good.